Hello, good afternoon, Professor. We are from Santuan, and we choose the country called Malaysia. And my name is Xian Li, and this is my mention number. My another friend is called Zhang Yidan. This is her mention number. This is our overviews. We have total 11 overviews. So let's start introduction to Malaysia first now. First one, let's introduce Malaysia. It's located in Southeast Asia. Capital city is in Kuala Lumpur, and population is about 34 million. And multicultural society, Malaysia's Chinese, Indians are indigenous groups. Upper middle income country with strong economic growth in Malaysia. So main industries that include tourism, electronics, and palm oil and petroleum. Malaysia has a relatively great uh, healthcare system and high HDI. However, the country faces sustainability challenges such as pollution, obesity, and deforestation. So Malaysia has achieved strong human development, but sustainability challenges still need to be addressed. Second overview is about understanding HDI and PHDI. HDI stands for Human Development Index. It measures a country's development based on health, education, and income. Let's look at this picture. It's about the Gini index, the life expectancy index, and education index. So high HDI does not always mean high sustainability because PHDI PHDI admits that adjusts HDI by considering environmental pressures such as carbon emissions and resource consumption. Let's look at this picture. It's about sustainable development. So as I just said that high HDI does not always mean high sustainability. The third is about overview of WHO health indicators. Let's start now. So what is WHO? WHO indicators are used to evaluate Malaysia's public health condition, including life expectancy, HALE, leading causes of deaths and risk factors health system overview. The number 4 is about the life expectancy versus HALE. We look at the life expectancy and birth in the left diagram. It represents that females in Malaysia has a higher life expectancy than males. Why? Because smoking among males are healthy style work strength higher disease risk than women. So, let's look at the right life expectancy and birth rate compare global. Malaysia's life expectancy is higher than the global average, but longer than the Western Pacific regional average. Because COVID-19 in 2021 has inequalities and public health challenges still exist. We look at the HALE. The left one is also about the house life expectancy, HALE at birth in this diagram. It means that females in Malaysia have a higher house life expectancy than males. Males face higher health risks such as smoking and work stress, as just said that the right is about Malaysia has better health care and living standards than many countries worldwide. However, Malaysia still faces chronic diseases and lifestyle-related health problems. The number 5 is about the leading causes of death. So in Malaysia, we compare these two pictures. For females, a higher rate of ischemic heart disease and COVID-19 disease chronic diseases strongly affect males' health. So females have for males that about higher rate of heart disease, same as female, the lung disease and the road injury, lifestyle and smoking increase health risks. The conclusions are about the communicable diseases are major causes of death in Malaysia. Okay, let's look at number 6 about mental health risk factors. We compare these two diagrams. The key risk factors is about the hypertension. It occupied for 14.8%. The adult obesity occupied for 22.1%, and tobacco use occupied for 70.4%. Analyze that about lifestyle-related diseases are becoming major public health challenges in Malaysia, and urban lifestyles are healthy diets and little physical activity contribute to increasing health risks.
Now we move to one of the most important parts of our presentation, the comparison between HDI and PHDI. Malaria's HDI in 2023 is 0.819, which places malaria in the category of very high human development. This reflects strong achievements in healthcare, education, and income growth. Malaria's HDI has steadily improved since 1990 due to economic development and better public services. However, when environmental pressures are included, malaria's PHDI becomes lower. This happens because rapid industrialization, urbanization, pollution, and deforestation reduce sustainability performance. In other words, malaria has achieved strong human development, but some of this development has environmental costs. This is the key message of our presentation. High HDI does not always mean sustainable development. Malaria currently faces several sustainability challenges. These include air pollution, urban emissions, climate-related risk, and environmental degradation. WHO data show that PM 2.5 concentration in malaria remains relatively high. Rapid industrialization and urban growth increase environmental pressure. Another important issue is palm oil production and deforestation. Although the palm oil industry contributes significantly to Malaysia's economy and exports, it also creates environmental damage and biodiversity loss. This demonstrates the trade-off between economic growth and sustainability. If environmental issues are not controlled, they may negatively affect public health and future development. Therefore, sustainability policies are essential for long-term welfare. To improve both health and PHDI, malaria needs stringent social and environmental policies. First, the government should increase healthcare spending and improve healthcare access, especially in rural areas. Second, malaria should strengthen preventive healthcare by promoting healthy lifestyles, exercise, and anti-smoking campaigns. Third, expanding the medical workforce and healthcare infrastructure can improve healthcare quality. In terms of sustainability, Malaysia should support green technology, renewable energy, and environmental protection policies. For example, reducing carbon emissions and controlling forestation can improve environmental sustainability. If these policies are successful in Malaysia, can achieve better public health outcomes, higher health, and stricter sustainable development. This slide discusses the relationship between economic growth and sustainability. Economic growth brings many benefits such as higher income, better infrastructure, improved healthcare, and more employment opportunities. Malaysia's economic development has clearly improved living standards and human development. Human rapid industrialization can also create environmental costs such as pollution, resource depletion, and climate risks. This means there is often a trade-off between growth and sustainability. If economic growth is not properly managed, environmental degradation may reduce long-term welfare. Therefore, Malaysia must balance economic growth with environmental protection. Sustainable development means achieving economic progress without harming future generations. This is one of the most important policy challenges for Malaysia today. In conclusion, Malaysia has achieved strong progress in healthcare and human development, whose indicators show improvements in life expectancy, healthcare access, and overall living standards. Malaysia has also a high HDI level, reflecting successful economic and social development. However, sustainability challenges remain significant. Environmental degradation, pollution, obesity, and chronic diseases continue to affect public health and long-term sustainability. Therefore, Malaysia should strengthen healthcare policies, promote healthier lifestyles, increase environmental awareness, and support green technology. The key lesson from our analysis is that development should not only focus on economic growth, but also on sustainability and the quality of life. Balanced development is essential for long-term health, environmental protection, and economic well-being. Thank you very much for listening.